Our next guest today is a special guest all the way from Porterville. I'm going to try her name. We rehearsed it 10 times before we came on. Ela Pandya. Ela Pandya?
Yes, that's good.
That's close enough. Huh?
Yes.
Now, you are in the medical business.
Yes.
You, your husband, your daughter, several other people. You have a medical group, Freedom Medical Group.
Yes.
And also a surgical hospital.
Yes.
That you do surgery at.
Yes.
And you've been involved in that for years.
Yes.
And now you want to take your expertise and apply it to help at the hospital. And what's the name of the hospital?
Sierra View Medical Center.
Yeah, and that's in Porterville, right?
Yes, it's a Tulare.
Yeah, in Tulare. And they're electing a board of directors.
Yes.
And you want to be one.
Absolutely.
Now, we have a lot of candidates on our show here. We've never had somebody running for a hospital board. Tell me about that a little bit.
You mean the position?
Yeah.
Well, it's a district hospital, so it has to have a board of directors, basically governing board.
From the district.
Yes.
Yeah.
And that's why it's an elected position. And basically the board members work with the administration, the CEO, and the top management.
Okay.
And
they're the policymakers, I'd imagine, yeah.
yes, and they kind of guide and decide on a direction. You know, it's sometimes you need someone from outside to develop ideas and plans for the growth and serving the community better.
So will the election, will you be on the ballot in November?
Yes.
Just with, like, President Biden, Trump, or the hospital board? It'll be on the same ballot, right?
Yes.
Nice, nice. And I guess, I don't know if we have those here in Fresno. I know we have hospitals, but I don't remember ever voting for a board member. Are there big issues? Is it a contentious race?
Well, there are two other candidates running against me.
Okay.
And the issues to me are big because I've been doing this for 32 years. And as a philosophy in our practice, we have never said no to a patient, whether they have insurance or not.
Yep.
But you know, Central Valley is an agricultural community and feeds the entire nation.
Yeah.
But that also means we have a lot of underserved community of people that work on those farms.
People who might not have the insurance coverage or to be able to get a heart treatment or cancer treatment or whatever. It's all very expensive, I'm sure.
Yeah. And so in the last few years, what I have seen is that insurance companies have offered Medicare and the Medicaid programs in the state this arrangement where they take the healthcare funds, dollars, and they say, don't worry about it, we'll manage the funds and we'll take care of these patients.
Yeah.
And then that itself is an expense to create such an organization.
Yep, yep.
And then they have huge staffing. And then those plans that cover these poor people and the agricultural community, those plans don't work for them.
Sometimes all the money's used up by the time it gets to the people who need it.
And on a day-to-day basis, I'm working with our patients, figuring out how I can help them. I sometimes have to have them help me to get paid.
Yeah.
So there is so much going on in the last few years that I feel like things need to change. Because we can't leave these people unattended, uncared for. But they're confused. They're not educated enough to navigate the complicated system that has been created. And in the process, what has happened is the hospitals get money from the government as well, but the physicians end up looking like the bad guy. And I just want to be there to see how I can contribute my perspective, because normally board members, people on the board normally are not people who have worked in the administrative.
You've worked in it, you've managed these funds,
Yeah.
healthcare funds, and you've maneuvered through this. It's a mystery or a puzzle sometimes to get through and get things paid for.
Exactly.
I'm very well educated, I've always had plenty of money, but all of a sudden now nobody has any money, and we have to turn for help with the county, and you got to file all these papers and stuff. I don't know how people do it. It
is very difficult, and especially if you're not well educated,
Yeah.
it is impossible to be able to navigate. And we have we have a policy that we are going to help as much as we can. So our staff is also very trained to look at it that way. And then currently with COVID, things have just gone downhill really
Yeah,
fast.
gotten really bad, I guess. So I guess sometimes the surgeon is the last guy to get paid, and everybody says, "Oh, there's no money, so you don't get paid." I mean, everybody gets paid. Nobody has a job where they don't get paid.
Yeah,
So-
exactly. When the insurance companies tell me that you cannot bill the patient, but we are not going to pay you, then I have to ask them, either you have to pay or the patient has to pay.
Right.
You don't go to a gas station and fill up your tank without paying for
So I
it.
can't pay, right?
Yeah,
Right.
and the surgeon works all night to protect someone or save someone from a ruptured appendicitis and appendix, and here you are, begging to be
Right.
paid after 2 years.
They're the last many times. People don't realize that. So
And the hospitals don't, administration, they don't understand that either.
Yeah.
Because they get a lot of funding for being existing in an underserved area.
Right.
So they get additional funds. So the hospital administration also doesn't understand what the physicians that are serving the community, they go through. And it's a real mess.
well, the administrators get paid, the nurses get paid, everybody at the hospital gets paid, and then sometimes the surgeon's the last guy, and they're out of money. So
Yeah, so I feel like I can be on the board and give my perspective and maybe have some influence on the policies and procedures that govern the hospital.
at least some insight
Yeah.
would be good. Would be good for the. How many board seats are there?
5.
And are there 3 on the ballot this time?
Yes.
And is it all for 1 seat or 2 seats or?
No, so in Porterville, I guess it was required that districts divide them up into zones,
Oh, I see. Okay.
residential zones. So from my zone, there are 3 people
3 people running
There is
for 1
another
seat, so-
zone, another seat is the other zone.
Well, I got to tell you, you're the only candidate I've heard about, so I can't vote there, of course, but I think you should do very well. You're very smart. You have a lot of experience in healthcare administration,
Yes.
and you understand there's constantly changing rules by the government.
Yes.
And I think you've seen the COVID crisis too.
COVID has really driven me hard for this because, look, government gave a lot of funding to the hospitals that to manage COVID.
Yeah.
And the hospital doesn't test periodically its own employees who can be carriers.
They can be carriers
Yeah.
very easily.
So it's common sense that you test your employees. We test our employees because we want to make sure our employees are not passing on that to our patients. So we test them. They don't like it sometimes because it's uncomfortable, but we have to do it to protect our patients. The hospital doesn't test its employees.
Wow.
So what are they doing with that money that they got? They should be using those funds to help the community
Yes.
stay protected.
One hospital
So-
employee in a very vulnerable community is giving it to other employees and to
And-
the vulnerable people. And
Exactly. So it just doesn't make sense to me that they would get this funding and then they would not test their own employees. There are so many dissatisfied and upset employees at the hospital because they don't get tested. Sometimes they have to fight for PPE.
they must feel it under threat every day. Come to
Exactly.
work
And they're essential workers.
Very
They
essential.
can't say, I'm going to walk away to protect myself. My husband cannot say, I'm not going to fix a gallbladder because I'm afraid.
I'm afraid of COVID or something. You got to do
Yeah.
the job. Yeah.
Yeah, so that actually drove me hard. I mean, I always had opinions about things, but when COVID happened, I realized I have to.
I think we found your website, and we're showing some information on the
Oh.
screen about that. But what if somebody wants to get involved and help in your election? Is there a way to get involved?
Yes, the website has email address. They have the phone number. I guess the best thing they can do is spread the word and share that. I have been involved in the community since the day we came to Porterville in '88. I've been a member of a global organization that has a chapter in Porterville for 26 years. Through that organization, I work with UN for the Sustainable Development Goals. And that's where I learned even more that health is everything. If a person is not healthy, they can never get out of the cycle of poverty. You cannot, if you don't have education and health, there is no way you can save that person.
That's right.
And then governments have to donate to the UN to go places and fix the problems. We have to start from the base and take care of people, provide them education, and then eventually in a few years we will see that we don't have to have global goals of sustainable development, we can do it right here in our backyard. And that's where it starts.
Well, tell me the web address. Let's see.
It's very simple, myname.com, elapandya.com.
ELAPANDYA.com, elapandya.com, ELAPANDYA.com. I saw it today. It's a beautiful website.
Oh, thank you.
There's a lot of information there.
Yes.
Information on Ela and her campaign and why you should vote for her. And you should check her out and know her before you vote, because I think once you see her website and hear this great interview, I think they're going to want to vote for you.
Well, I appreciate you sparing time for
Sure.
me.
We have a minute left. Anything else you want the viewers to know?
No, like I said, I have raised 2 great kids in the Porterville community.
One's a doctor.
One's a doctor and one's a computer genius.
Computer genius. Good.
Yes, and I just want to give back. It's time for me to do something more.
Yeah.
I have done a lot, but I'm at a point where the community has given me a lot, and it's time for me to do something in the healthcare business.
Probably there's few board members who will come with the experience that you have. So
Yeah.
I hope you do well. I'm going to try to say the name one more time. ElaPandya.com. Go visit there. We'll be back with more Newsmakers right after this.
Thank you for having me.